It's a little uncomfortable for me to talk about because it's something that's becoming very popular and trendy. It's been well marketed and probably over marketed, but that is a very specific bunionectomy procedure. And I have had, I don't even know, countless patients come in and tell me they want a Lapiplasty to fix their bunion. And so it's very uncommon and unusual to have patients come in and tell you what surgical procedure they want for anything. I mean, maybe like a vasectomy, which obviously is for a very specific reason. But I don't even know of patients that go to their doctor and say to their ophthalmologist, I want my cataract removed. First, they have to know that they have a cataract. Unusual, unlikely, and uncommon to have somebody come in and say, I'd like a Lapiplasty, can you do that surgery? Do you do that? And so let me tell you about a Lapiplasty. A Lapiplasty is really just a modification of the equipment used to fix a bunionectomy. There have been many procedures over the years that have tried to address the fact that bunion deformities occur in more than one of the three cardinal planes. And so there are many excellent procedures that effectively repair multiplanar deformities that we call bunions. The Lapiplasty is an attempt to repair it in all three planes. And by and large, if it's done correctly, it will do that. It is not the only procedure that does that. So a Lapiplasty addresses a bunion deformity in multiple planes in the following way. A bunion tends not only to be a deviation of this metatarsal away from the others and the toe drifts in, but it also tends to rotate. So when it does that, fixing it by just shaving off the bump or just moving the metatarsal back towards the other doesn't address the problem with the rotation. A Lapiplasty does. It is a good procedure. It's probably a more technically difficult procedure than some of your other garden variety bunionectomies because you just don't do them as often. And the problem is there are doctors that are trying to make them your garden variety procedure, and it's oftentimes overkill. I've had patients that literally, they do only need their bump shaved, and there's like no angle between the first and second metatarsal, and let alone an exaggerated angle. And they were coming for a second opinion on whether they should have the Lapiplasty done. It is not a procedure to be taken lightly. It is a major foot procedure. What the Lapiplasty does is it fuses the first metatarsal cuneiform joint. So these two bones will become one bone. And there is another procedure that it's sort of taken the name from called the Lapidus procedure. The Lapidus procedure was a first metatarsal cuneiform arthrodesis or fusion that was probably described 100 years ago, probably literally in the early 1900s, 1910, 1911, somewhere around there. And it is a tried and true procedure. It works very nicely. It fixes bunions and it fixes severe bunion deformities. It is not meant for a mild bunion deformity. It also is primarily for bunion deformity where that cuneiform bone is uncommonly shaped. It's shaped more triangular and doesn't have a flat surface for the metatarsal to articulate with. In that situation, the Lapidus procedure works very nicely. There are some complications that can develop with a Lapidus procedure, but most surgeons that do a lot of Lapidus procedures know how to reduce the risk of those, and it's a very predictable outcome, and patients do very well. That said, the Lapidus itself had become a very trendy procedure and was probably being overused, and I think the most complications I've seen from other doctors when the patients come into my office, I think most commonly it's because the doctor was overcorrecting something. The deformity was not that bad and they went with a big procedure for it and it didn't work out well for them. So again, with regards to Lapiplasty, is there a place for it? Absolutely, absolutely. The fixation that is used for it is key to making it successful. It can easily have very similar problems to a Lapidus procedure. It can also have problems that are similar if you choose the wrong patient to perform it on. So again, selecting the right procedure for the right patient is key. It's essential. And with regards to the Lapiplasty, it might not be conducive to your lifestyle. I have a lot of patients that are working and they can't take a lot of time off work. So you can offer them one of three things. You can say, listen, if you can't take the 6 to 8 weeks off that you will need to recover from a Lapiplasty, then you're down to two choices. You can either not have surgery and live with the pain, or we could do a procedure that will not be as comprehensive, and you might not get the absolute optimal outcome, but you might have pain relief for the rest of your life. And in that situation, you might only be off your feet for 17 days or 2 weeks, however long it takes until the doctor takes the sutures out and lets them back into a regular work type boot or shoe. Find ourselves as surgeons having to weigh all the factors of your lifestyle to make the right decision. I'm not an advocate of doing a procedure that is less comprehensive than is necessary. I'm not an advocate of recommending procedures that are less comprehensive than necessary to address the deformity. However, if I know you're not going to be retiring for 20 to 30 years, so you're going to be living with this pain until then, and you need relief, I am willing to compromise if you are. And obviously, I would only do that with a procedure that I feel very confident will give you long-term relief and will have great success. So it's very important at the end of the day that all these factors are discussed with your doctor, and you have to have the right chemistry with your doctor to be able to discuss those things openly and comfortably. And if you do not feel comfortable discussing those issues with a doctor, then you probably should get a second opinion or switch doctors.